Well, thank you, Deputy Speaker, and I rise to speak on the Health Legislation Amendment eHealth Bill of 2015. This bill is a part of the Coalition Government's responsible and effective approach to the health system in this country. Mr Deputy Speaker, I do want to just say I come to this debate today in this place having been the Shadow Minister for Health and Human Services in the state of Tasmania for 4 years, and as the previous contributor spoke, this issue has been a part of public policy discussion for many years and, in my view, for far too long. Our health system is an extremely important part of the fabric of our society. It consumes enormous amounts of financial resources, as taxpayers would expect it to, but there are ways in which we can now use technology to ensure that efficiencies are in place, that double-dipping, duplication, doctor shopping or whatever, we need to be looking at all of these issues to ensure that the hard-working taxpayer money that's invested into the area of health in this country is working at its best, and we are extracting every opportunity from every dollar spent. This government acknowledges the difficulties that some facing Australians today in seeking medical assistance from multiple doctors, sometimes in different cities, areas and maybe even states. The eHealth system will greatly improve patient health outcomes as doctors are able to access patient records quickly. This government is cognisant of the need to make our comprehensive healthcare system more efficient and more effective. This bill is a part of the process and specifically seeks to amend the Personally Controlled Electronic Health Records Act of 2012, the PECA Act, in order to better facilitate positive outcomes for all Australian systems when it comes to health. Now, under the previous government, the Healthcare Identifier Service came into being, which is the foundational service to the PECA, and the Healthcare Identifier Service is a national system for consistently identifying individuals, individual healthcare providers and healthcare provider organisations for health communication purposes. Both the HI service and the PECA are helping to facilitate a more efficient and effective healthcare system. And this government is seeking to build on and improve the current service in a number of significant ways. First, however, I believe it's important to understand the reforms that this government is enacting within the context of this electronic framework. This national electronic system commenced in July 2010 and was the result of a joint initiative of all Australian governments as part of an accelerating work on national electronic health record system to improve patient safety, support safe and efficient sharing and storage of personal health information, and increase efficiency for healthcare providers. It is jointly funded by Commonwealth, state and territory governments. Under the previous government in 2012-13, a review found that the core functionality of the HI service was operating effectively, but given the PECA system is now impacting directly on clinical workflows, there are emerging issues that need to be addressed. The HI review made 24 recommendations to improve the HI service. In response to some of those recommendations, the PECA system was implemented in July 2012. Its aim was to overcome significant issues facing healthcare arising from the fragmentation of health information across a vast number of different locations, different systems. In many situations, quick access to key health information about an individual is not always possible, but it is often necessary for the patient. A review of the PECA system was undertaken in 2013. It found that there was overwhelming support for continuing implementation of a consistent electronic health record system for all Australians, but that a change in approach was needed to correct early implementation issues. The PECA review made 38 recommendations aimed at making the system more usable and able to deliver the expected benefits in a shorter period of time. The recommendations include establishing new governance arrangements, moving to an opt-out system for individual participation and improving system usability and the clinical content of records. Mr Deputy Speaker, the government strongly believes in the benefits of an effective and efficient electronic record system. Such a system rectifies many issues facing our healthcare practitioners and delivers better results for our citizens. The Coalition Government's response to the recommendations of the PECA review were announced in the 2015-16 budget. We committed to strengthening eHealth governance and operations by establishing the Australian Commission for eHealth to manage governance, operation and the ongoing delivery of eHealth. We also committed to trialling new participation arrangements, including opt-out. We committed to improving system usability and the clinical content of records, and we are revising incentives and are delivering education and training to all healthcare providers. The government is also renaming PECA, thank goodness for that, Mr Deputy Speaker, to the My Health Record. What do you think? You agree? Because whilst this government is committed to lower, simpler taxes, we are also committed to simpler and more efficient language. As I said, thank goodness for that. We have made significant commitment in the eHealth space and are today delivering on those commitments. As a sideline, you do often wonder how on earth some of these acronyms ever get into operation. You wonder why sometimes you read one and look at it and you go, didn't actually someone put those letters in a row to see what it spelt? But obviously some don't. Or either that or they've got a very good sense of humour. Getting back to the main point, Mr Deputy Speaker, whilst we are delivering on recommendations made through extensive reviews, we are also staying proactive, very proactive in this space. Trials of participation arrangements, including, I think, the important opt-out trials, are intended to inform future strategies for increasing uptake and meaningful use of the My Health record. This government appreciates that limited access to health information at the point of care can result in a greater risk to patient safety, can deliver less than optimal health outcomes and assist in the avoidance of adverse events of treatment. We remain committed to decreasing costs of care and time wasted, and we know that this can be delivered through providing a more effective mechanism for collecting or finding of information. This bill will deliver on our commitment to making healthcare more efficient through avoiding unnecessary or duplicated investigations, reducing additional pressure on the health workforce and increasing participation by individuals in their own healthcare management. Our obligation to provide a comprehensive healthcare system is a priority of the government, but we are also vigilant in ensuring our healthcare system is as efficient as it can be, thus maintain our commitment to the taxpayer by ensuring the long-term sustainability of what is a very under-pressure health system. The Coalition Government will continue to lead the national rollout of eHealth technology and services and work with the states positively to support eHealth foundations and to finalise a national eHealth strategy, which will identify the priorities for future Commonwealth and jurisdictional investment in eHealth. Deputy Speaker, productivity improvements such as those that can be delivered by eHealth are needed. They are really needed to help counter the expected increase in the unit costs associated with the delivery of health care. Leveraging eHealth is one of the few strategies available to drive microeconomic reform to reduce Commonwealth health outlays. I remind this chamber that the annual Commonwealth costs of health care are forecast to increase by $27 billion to $86 billion by 2025 and over $250 billion by 2050. This is an enormous cost burden and is the consequence of maintaining a comprehensive world-class healthcare system. Yet whilst our broad healthcare system is important and integral in delivering quality of life to all our citizens, it is now what we would commonly call a very sacred cow. We should not be afraid to reform our healthcare system and ensure its efficiency into the future, and to ensure that hard-working taxpayers' money for a service that they obviously expect for them and their families is actually sustainable into the future, and as I said earlier, that we're getting the best bang for the hard-earning buck. Rather than being uncompassionate, it is irresponsible to maintain a view that our healthcare system is beyond reform, and any scare language around the fact that any reform is bad for the health system, that is not helping the public policy debate in any way, shape or form. It is irresponsible, I should say, to refuse to make our tax dollars work harder in our expansive healthcare system. That is why reforms enacted under this government are so essential. It is only a coalition government which can deliver an effective, efficient and economically sustainable healthcare system today and for future generations. Whilst the previous government implemented the PECA system as a first step, today this government is making, I believe, meaningful progress in overcoming serious issues facing healthcare arising from the fragmentation of health information. We understand the opportunities that technology provides us, and that is why we've embraced eHealth and are developing a more efficient system. We acknowledge that health information is spread across a vast number of different locations and systems, especially as more Australians are constantly moving between various state and territory health systems. It's estimated that 2.5% of hospital admissions are due to adverse drug events due to incomplete medication history. This is not an acceptable state of affairs in any first world country. It's not acceptable anywhere. I know that my state of Tasmania and the electorate of Braddon is not only the only state and constituency facing hospital shortages. That is why this government is making every effort and taking every opportunity to leverage better healthcare outcomes for all. 36% of visits involve the clinician spending at least 5 minutes or more locating information. Just think about that. 36%, over a third of all visits to any clinician is spent, or 5 minutes of it is spent, just locating information. And in any language, whether it be the health system, the education system, time is money. Time is money. In the year 2009-2010, 83% of Australians visited a GP, with a total 116.8 million general practice services paid for by the taxpayers through Medicare. The collective waste of time and energy over these huge volumes of patients is staggering, and that's only looking at the opportunity costs associated with GP visits. When you take into account that this waste of time is constant among all healthcare practitioners, it is astounding, and it has significant cost to the taxpayer. Currently, 10% of laboratory tests are avoidable through electronic health records. That's right, 1 in 10 very expensive laboratory tests are unnecessary due to duplicated investigations that these tests occur, not only wasting time but taking up time and resources that could be directed to more necessary testing. We don't have to have in this place an ideological debate about the left view of health, or the centre-right view of health, or the right view of health. This just makes sense. And if we can improve the circumstance of all Australians and get a better return on hard-earned taxpayers' money, it's got to be a good result, irrespective of what side of politics we may be on. Currently, Mr Deputy Speaker, when a person attends a new provider and their previous test results are not available, and this leads to huge unnecessary duplication, especially as Australian citizens are more fluid, as I said, in their living arrangements. These are just some of the areas that this bill seeks to address. This bill will change the name, as I said. This bill will enable opt-out trials to be undertaken for individuals in a manner that retains the same patient controls as were provided, but while these trials are operating in defined areas, the existing opt-in system will continue to operate everywhere else in Australia. If the trials are successful, and I suspect they will be, the government will decide to implement opt-out nationally. This bill enables that to occur if and when that is the case. To make way for new government arrangements that will be established, this bill will abolish the existing PECA Jurisdictional Advisory Committee. Mr Deputy Speaker, in order to better protect the sensitive information that can be contained in my health record and to provide a more graduated framework for responding to inappropriate behaviour that is proportional to the severity of a breach of either the HI or my health system, the bill will introduce new civil and criminal penalties and provide that enforceable undertaking. This government is delivering a more comprehensive and effective system, and we also strongly believe in the consequences of breaching the integrity of that system. Mr Deputy Speaker, in the short time that I have left, I just make a plea to all members of parliament that we should all be committed as one to efficiencies within our health system. We should not be scared of the technology that is now available to us. Every man, woman and child now knows that with all online purchases and online records, that much of our lives are exposed to basically the world. And I would encourage everyone to understand that it is in the best interest of the health system of this country to move very much to a fully implemented My Health record. I thank the House.